Johnson. We have Jonathan here with us this afternoon, and Jonathan was referred in here by his brother. Thank you, Jeremy. And Jonathan came in here with lower back pain, mid back pain, neck pain and stiffness, and upper back pain across his shoulders here, as well as some right knee pain and difficulty sleeping, as well as a lower energy level. So this is only his second treatment. We did send him out for x-rays and MRI of his lumbar spine because of the radicular pain he was having. And we did find that he had a transitional segment between L5 and S1. Okay, let's close your eyes and flex your hip forward and backwards for me, which allows me to do a little bit more of aggressive treatment with him now that I know exactly what's in there. And if you're coming here from out of the country or out of the state to get treatment, or even out of the city to get treatment, you always want to bring your x-rays and or MRI, or both if you have them, with you, because I do need to see those before I do ring dingers on people. Not always, but sometimes. If I find something in my examination, I would have to send you out to get one here in Houston. We don't do those here in our office. Okay, so Jonathan, I'm going to have you take your glasses off and just lay them on the table there for me, please, sir. And I'm going to have you lay on your stomach here first today. Face up in here. Now, he's 14 years old, and on his x-rays it still showed significant growth plates in his bone. So I am not going to do a ring dinger on him today, much to your dismay. Alright, he'll probably be signing off about right now. That's alright. The people who are interested in learning can learn. Now, when we were going over his x-rays, it was real evident that his left ilium was higher than his right ilium, which caused him to have a curvature out to the right side here in his lumbar spine. That's called a compensatory scoliosis. It's from the pelvis being misaligned. So I'm adjusting his sacroiliac joints and his sacrum. And his sacrum right here at S1 where he has the transitional vertebra. The body didn't know whether it wanted to become a lumbar vertebra or part of the sacrum, so it became part of both. There we go. Now I'm adjusting his lower thoracic. Exhale. There you go. Okay, I still got one here. Yeah, relax it. That's it. Okay. Okay. Okay, now his legs are exactly even. And Jonathan, tell me if this causes any tightness or pain in your lower back.
No.
Okay, great. So I'm going to pop your head up here now. Now I'm putting the cervical lordosis back in here from the side view with P to A adjusting in the Z-axis. Okay, let's turn you on your back now, please, sir. Yep. And slide down just a tiny bit, about an inch, right there. Okay. Bringing his head up and back over his thoracic spine where it's supposed to be. There we go. Now slide down just a little bit more. And put your arms straight out to the sides, palms up. So we're adjusting his AC joints bilaterally, his sternoclavicular joints bilaterally, and his costosternal joints anteriorly here, bilaterally as well. Good. Okay, you can relax your hands on your tummy for a second, Jonathan. I want you to just relax your knee and my hand here. There you go. You should have felt that in your knee and your back. Did you?
Yep.
Okay. Same thing here. There we go. Good. Okay. Now let's come over here and sit up and face towards Joseph there. That's it. Your bones fully ossify or fully calcify around the age 17 to 18. So he's got about 3 years left of bone growing, at which time we want to realign his structure so that they grow properly without having that scoliosis in there by lining his pelvis up. Good. Okay, let's stand up here in front of the mirror. Alright, so I'm going to have you close your eyes again, Jonathan, and bend your head forward and backwards. And then neutral. Yep. Take a look in the mirror right now. So your head's a little forward and left, so let's pull these guys up and back. This is your homework. Have you been doing this? Yes. Good man. So we're going to come straight back and you're left, so we're going to go right. Hold that right there for just a moment. Okay, now relax again. And let's try that same thing again. Forward and backwards. This should feel smoother. Try it and see. Neutral. Yep. Does that feel like you're standing up straighter too? See his head's come up and back? That's where it's supposed to be. So Jonathan, come on over here on this table. I am going to do some traction on you. I'm not going to do the actual adjustment on you, but I am going to traction your spine. Lay on your back with your head up here. Now you guys have never seen me do this before. This is what I do on some patients that are in Jonathan's situation. Okay. I'm just going to traction his spine. I'm not going to actually decompress it with a manual high velocity, low amplitude thrust. There we go.
They sound off too early.
Mm-hmm. Nice deep breath in. Okay, now exhale. And you're just going to feel me putting some traction in there. Do you feel that? Mm-hmm. How far down do you feel that? Okay, keep breathing. Mm-hmm. See, I'm just putting traction in there. I'm not actually delivering the thrust. Exhale. There we go. Good. Now, could you tell how far down you felt that one? How far?
Lower back.
To your lower back? Okay, good. There we go. And see there, he is still kicking. Very good. Okay. Just relax your head in my hands here. Okay, we got most of these already. I'm just checking this. There's one more. Okay, good. Excellent. Yeah. I don't have any heads on my trophy wall yet. I won't start with his. Alright, let's come over this way. If I had any on my trophy wall, I'd be Renee's. Okay, come over here. Stand in front of the mirror again. And I'm going to have you flex your head forward and backwards for me again, Jonathan. This should feel even smoother. See how his range of motion improved going backwards? See, he's standing up straighter. This hump's starting to go down. Very good. How's that feel? Good. So would you mind sharing with our YouTube audience how you feel after your first 2 treatments? It's only your second treatment.
Feel very good.
So you glad you came in?
Yep.
Okay, thank you for sharing your story with us on YouTube today. This is your Houston chiropractor, Dr. Gregory Johnson from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.